Hello and welcome to my channel. In this channel, we explain various nursing concepts in a simple form for a better and easy understanding. These videos could be used by both LPN and RN students as well as nurses who are trying to refresh their basic concepts. My name is Nasmosh. So in this video, we're going to start talking about cancers that interfere with the reproductive system or cancers of the reproductive system, okay? And let's start with our males. And with the males, we'll talk about prostate cancer. Prostate cancer is a common cancer. And when do we start screening for this? We actually start screening for it at 50, at the age of 50, unless the individual is of high risk. And we'll talk about the risk factors. And how do we do the screening? We actually obtain a PSA level, which is a blood work, as well as we complete a digital rectal exam. And something you need to remember for the test or even when you're practicing, always collect the PSA levels, the blood, right, before you do the DRE, the digital rectal exam. Why? Because when you perform the digital rectal exam, it actually increases the PSA levels and you'll end up with a false level or even a false positive PSA. So, what are our risk factors? Risk factors for prostate cancer include an older age, race, genetics, as well as diet. And the signs and symptoms of this include hematuria, nocturia, urinary frequency retention, hesitancy, as well as frequent bladder infections. And with bladder infections, think about it. You have something that is enlarged, compressing your urinary urethra, where the male reproductive, they actually urinate. So something is blocking it. So you're retaining this urine in your bladder and stasis. Remember, stasis leads to a good mode of growing bacteria infections. So how do we diagnose this? We already talked about PSA levels. And with PSA levels, we are looking at levels above 4. So a 4 in a PSA level is an indication that person could have prostate cancer. Transrectal ultrasound as well as biopsy. How do we treat this patient? With this patient, we could treat them with radiation, hormonal therapy, chemotherapy, as well as surgery. Some complications that could arise with prostate cancer include, of course, our urinary issues like incontinency, erectile dysfunction, as well as radiation cystitis, okay? So let's start talking about our female reproductive cancers, and let's start about breast cancer. So with breast cancer, screening for this actually starts at the age of 40. And how do we do this? It's through mammograms and self-checks. And these self-checks are done monthly. But individuals who are at a higher risk, we'll talk about the risk factors, but people who are at a higher risk, we normally obtain a baseline mammogram at the age of 35 prior to starting the annuals, which are at 40. This is also a question, so remember this. Community health. So risk factors for this include smoking, hormonal replacement therapy, obesity, long-term use of oral contraceptives, as well as genetics and early menarche. Signs and symptoms of this include like nipple retraction, ulceration, or even discharge, dimpling of the skin, of course, around the breast, firm immobility, and non-tender lump. How do we treat this? We could do hormonal therapy, chemotherapy, and surgery. It could include either mastectomy or lumpectomy. And what do we need to know about a mastectomy patient? As a nurse, there are some certain precautions that you should have for a patient who has undergone a mastectomy. And what is a mastectomy? They'll go and remove the breast tissue. Depending on the site it's been removed, we normally avoid using that arm for either blood pressures, blood drawals, or any kind of injection in that arm. Okay, we wear a sling when ambulating, as well as we wear loose clothing and perform hand and arm exercises to increase our range of motion and reduce edema. So these patients are the patients you'll see do not take blood pressure on the left arm, and normally you see it's like a little bit edematous. And why? Because when they do the mastectomy, they normally interferes with the lymph tissues, and the circulation of that arm is kind of reduced. Let's talk about endometrial cancer. What is endometrial cancer? Endometrial cancer is actually the inner lining of the uterus cancer. Risk factors of this include exposure to estrogen without progesterone. Symptoms of this include postmenopausal bleeding. This is somebody who's bleeding after they've already have menopause, right? And when you have menopause, you don't bleed, okay? Cervical cancer. With cervical cancer, it's usually caused by HPV. That's why we normally do the HPV vaccine. And signs and symptoms for this includes painless vaginal bleeding. Okay? And to prevent cervical cancer, we do this by getting the HPV vaccine. HPV vaccine is normally administered over a 6-month period. One is given 3 injections during a 6-month period this is normally prior to college. Okay, so when they ask you community health, when do we administer this vaccine? A HPV vaccine is normally before college. So a 17, 18-year-old can get this. We also do like cervical screenings, and which are completed via pap smear between 1 to 3 years in relevance to the patient's risk profile. So if the patient is at risk for cervical cancer, we perform this pap smears depending on 1 to 3 years, right? Depending on their risk. And the pap smears are started, remember this, pap smears are started 3 years after starting intercourse or by the age of 20. Let's talk about ovarian cancer. With ovarian cancer, this is an epithelial tumor that grows on the surface of the ovaries and spreads rapidly. Signs and symptoms of these are vague. That means it could be a late or a poor prognosis with it. So they are very vague, and this include like a GI disturbance, thus is low in survival rate. So you wouldn't know that somebody has this because the symptoms are vague. It's like GI discomfort. So you could think maybe constipation, maybe I ate something bad, but you're not thinking that you're having ovarian issues. And how do we treat our endometrial, cervical, as well as ovarian cancer? We do chemotherapy, internal or external radiation, as well as surgery. Thank you for watching. Please like, share, and subscribe to my channel. See you on the next one. Bye.